Welcome. I'm glad you've taken a minute to stop by this site to watch and learn a little bit more about this NC Health Guidebook that's been put together. We're trying to prepare the folks in Charlotte for these larger changes that are occurring in healthcare, and I'm really excited to tell you more about what we're up to. My name is Don Jonas. I'm Executive Director of Care Ring. Care Ring is a health and wellness agency that is based in Charlotte, and we provide a variety of services out in the community and at a clinic in Uptown Charlotte, and with some volunteer physicians. A whole lot of them, about 1,500 physicians, volunteer with us to serve the indigent. This guidebook has been put together by a team of experts from around the country and the state of North Carolina and locally here in Charlotte. So Health Leads, a group out of Boston that is really a premier thought leader and practitioner around introducing the power and the influence of the social determinants of health in communities, is with us. NC Child, which is a leading child advocacy group that looks at a host of different policies and issues impacting children, including changes in Medicaid, is part of our team. The Charlotte Center for Legal Advocacy is really the leading group in the Charlotte region around providing justice for children on a range of issues, including healthcare. Next Stage is our project manager, and UNC Charlotte is providing evaluation support. And all of this is due to a gift from the Kate B. Reynolds Charitable Trust, which has allowed us to pull all this information together to try to prepare folks for these changes. And change is coming. This is like the ref has blown the whistle, and we need to pause for a second and think through how all of these different disruptions in healthcare are impacting our community and healthcare, and particularly how people with limited resources access care. There's been digital disruptions that have happened throughout the healthcare ecosystem. They're definitely being felt by clinics and by providers and nonprofits that work in this space. There's this whole integration of life needs with healthcare needs that it's happening within nonprofits and across the community. And yet in the midst of all of these changes that are occurring, there is very limited understanding or recognition of how all these larger trends are impacting communities, about how all of these different big variables in healthcare are coming together really at the same time in many ways to fundamentally change the way we provide care and the way people access care. And so we want to talk with you about some of those changes, try to define what some of those key terms are that are happening that are making such a substantial shift and change in how we provide healthcare, and then hopefully prepare you and equip you for you and your organization and the people you work with and the supporters of your organization or your group, so that you can be ready to excel and thrive in this new environment. So think about the game that we're playing. If you were to look at this board, one person may look at it and say, this is definitely a chessboard, because it is a chessboard. And another person may walk in the room and say, nope, that is definitely a checkers board. And is it chess or is it checkers? The game looks the same. So in some ways, it looks like a checkers board. Healthcare is that way. You have hospitals, you have clinics, you have insurance companies, you have people seeking care, and we all sort of know the very simple rules of the game. But what's occurring in this total transformation of healthcare that we're seeing impacting and being played out across the country, and definitely right here in Charlotte, it's no longer checkers. It's now a chess game. So while the pieces on the board look the same and the landscape appears the same, the interactions that are occurring, the incentives that are happening, the players that are being introduced to the field are entirely different, and they're playing and acting and behaving in very different ways, which has the potential to do really good things. It also introduces some risk, particularly for people with limited resources, that they may not end up in the best place trying to live through and navigate through this new system. This is not anything new. The United States for years and years and years has had a highly dysfunctional healthcare system. Some people argue we have multiple systems that are all operating at the same time. We have a Veterans Administration system of care. We have a care for elderly folks through Medicare. We have an employer-based system for people who get health care from where they work. We have Medicaid system that's operating at the same time. We have an uninsured system of care where there's networks of groups like ours and others that try to help people. But what we are finding out when we step back and we look at the big picture, for years and years and years, the United States, when we compare ourselves to other advanced Western democracies, we are spending so much more than other places around the world, our peer countries we oftentimes compare ourselves with. We're spending a whole lot more, and yet our outcomes on virtually every health indicator is not as good as these peer countries. So if you look on the right side, you'll see here comes the United States looking at life expectancy at birth. And while there was a very slight increase noted just in the last month or so of an additional month of living, when you look at the big picture, we're not living as long as other people, and yet we're spending so much more. And there are so many other indicators like this that we could share that show this dysfunctionality in our system. So North Carolina is on the cusp of making a big change. We have, across the country, virtually all of the larger states in the United States have already shifted the way they provide care to people with limited resources through their Medicaid system away from a fee-for-service system to a value-based system or a managed care system. So North Carolina has been making plans to make this shift, and there's a lot of a major impact to this. So if you look at just the budget in North Carolina, it's nearly a third of the budget, really the largest single item within the annual budget for North Carolina is going towards Medicaid. And there's a huge number of people impacted by this. You see on this chart here, over half of the children in North Carolina are on Medicaid. Over half of the births in North Carolina are children that are on Medicaid. So you're looking at a system of care that's impacting 1 out of every 5 North Carolinians. It's a massive number of people that are on the precipice of shifting into an entirely new system of care. This really officially started about 5 years ago in 2015 when the General Assembly voted to make this shift into a transformed system away from a fee-for-service system into value-based care. And we'll talk a little bit more about what that means in just a minute. But there's one sentence that was there that kind of encapsulates the goal of what the General Assembly was looking for: to improve the health of North Carolinians through an innovative, whole person centered and well coordinated system of care that addresses both the medical and non-medical drivers of health. We could spend an entire semester in one of my classes at a university on this sentence because it has so much that's in there. If you look at the whole person centered, we're talking about people and families do not come in bits and parts. They are whole people. And then when you have a clinical intervention on one particular need or on one person in a family or of a need that a person has, we're trying to step back and look more broadly about how do you help that individual and all of their life needs beyond just their clinical needs to be successful. And you see that at the end. We're not just talking about medical interventions. This is not just about reforming the clinic setting. This is also looking at all those social determinants of health, those non-medical drivers of health, and how they impact people's lives. So in North Carolina, we were on the cusp of making this change back at the end of 2019. In October, there were over 100,000 Mecklenburg County residents that were receiving letters in the mail from the Department of Health and Human Services describing this new system. There are new, what they call prepaid health plans, these managed care companies that these folks that are eligible for Medicaid would need to be shifting into this new system. Beneficiaries were just starting to sign up in November of 2019. Unfortunately, as we got to the end of the year, the General Assembly was not able to pass a budget. And by early January, the Department of Health and Human Services suspended indefinitely the transformation. Now, it could restart again. It's going to take the General Assembly passing a budget and then allocating funds so that they could get this moving again. But there was a pause in this shift towards Medicaid transformation and value-based care. But while there was a pause in the shift, all of these larger trends and these larger changes and these impacts that are occurring across the America's healthcare system are still happening. That is not paused. So a couple of the key sort of definitions to be thinking about when we look at healthcare in America. The first one is this whole fee-for-service system, and this is the way it is currently today for Medicaid in North Carolina. There's very limited incentive for a provider to focus on the long-term outcome, health outcome of their patients. And in this visual, you'll see the state budget for Medicaid, which is a combined state and federal source of funds that is overseen through the Department of Health and Human Services. And then as you go left to right, you get to the providers, those that agree to process and provide care for Medicaid eligible patients, they have this direct relationship with that patient on the far right. So it's the patient and the provider in a fee-for-service system. The provider gets a fee for each time they provide a service. And if you're in that sort of a model, there is really no incentive to very quickly get the patient healthy. It's more of an incentive to keep providing more services. And where we're moving into is this managed care environment, which again, most of the states in America and certainly all the larger states have already made that shift. In this managed care system, there's a third party that's introduced, and the visual gets changed. So this was the fee-for-service model, but now we've got this managed care organization that's playing a really important role around care management for the patients. They have a required set of benefits that the Department of Health and Human Services assures that are in the suite of benefits that one could get. And there's also some value-added services that are on top of those benefits, but it gets a little more complex. So the managed care organization establishes relationships with the provider. And then again, the whole point of all of this, that patient at the very end, no longer is simply going to a provider that accepts and processes Medicaid to get services every time they need care. They're working through that managed care organization. And that managed care organization is really a gatekeeper to get that patient to the provider. And these are patients, keep in mind, that oftentimes have very low health literacy and virtually no experience navigating in this new world. Pay for performance or pay for healthy outcomes. This is a really important term that we're seeing increasingly across the healthcare ecosystem. One of them, you may have heard about the bundled payments. The Ortho Carolina orthopedic practice in the Charlotte region, and it's expanded across much of the Carolinas, is really a national leader on this. So if you look again on the left side is that traditional fee-for-service system where there's all these different providers that are doing lots of different services that are each charging for the work that they're doing. And the patient at the end of the day is going to be responsible for paying those, in this case, this model, 5 different services that are provided, most likely in 5 different places. And it's very confusing for the patient. It's oftentimes a challenge for the insurance company and the hospital and the providers to knit all that together. In this new bundled payment approach, you have a comprehensive, coordinated intervention. So you'll see the icons are all the same, and yet in the bundled payment approach, it's a negotiated fee between a payer, like an insurance company, and a provider, like a place like Ortho Carolina, that then presents that to the patient that says, we're going to, for one fee, one flat fee, and we're not going to charge you any more for it, we're going to do the whole suite of services. We're going to bundle everything together. And the provider takes the risk that they say they can do it for a less cost than what maybe the payer was going to pay for. And so they could make a small profit out of doing this work. But it's starting, and we're seeing more of it in ortho and orthopedic services, but it is really pushing into a whole array of different healthcare environments. And so we're seeing a lot more of this sort of approach to healthcare, which is very different from the way it's been in the past. The social risk factors, these are the social determinants of health, these larger drivers of health. There's extraordinary research that's out there that is really increasingly being accepted across America and nonprofits and beyond the healthcare space, that so many of the outcomes that determine whether someone is healthy or not happens far beyond a clinic. It happens out in the physical environment. It happens in terms of individual health behaviors. It happens in much larger socioeconomic factors that are driving and setting the course for someone's life trajectory. So that clinical care, while it's really important, it becomes less of a overall importance when you're trying to look at how do we create a system of care? How do we create a culture, an environment for people to be healthy? Finally, an important idea is this notion of insurance churn, that people, if you look at this visual, is of North Carolina from a few years ago, and you'll see how people, it's a chutes and ladders. People are employed, which is about half of the people in North Carolina. They're getting their insurance through their employer, but they lose their job and they may fall into the uninsured category. And then they may have some income coming in, so they jump up to the top of the ladder to the non-group, and they go and they're able to purchase subsidized insurance on the affordable care market. And then they get older and they fall into Medicare. So this is not uncommon for any state in America, but it's really important to understand how that's not a static market, that there's so much volatility and movement that's occurring within our system in the midst of all these changes that we're getting ready to do. So Medicaid transformation, and this is how we're going to like radically transform the way in North Carolina. It'll ultimately be 2 million people, not in the first wave once this gets reactivated, but ultimately 1/5 of our neighbors in North Carolina will be accessing um, healthcare services in an entirely new way. And if you think about it as a visual, there are certain rewards you can imagine from moving into a value-based care system. One would be reduced spending, because in the states that have moved towards this, their assemblies, their state legislatures, they're able to set an amount that they're going to pay towards Medicaid. They're going to cap that amount, and it makes it a lot easier to forecast. If you were a legislator in a state and you were in a managed care environment for your Medicaid program, and let's say you chose to just increase it by the cost of living, each year or over a certain number of years, you're going to know how much you're going to pay in future years. And if you're able to get providers and others and hospital systems to get on board, you can sort of see what you're going to be allocating um, towards care in the future. There's some rewards. So whereas in that fee-for-service system, it was a reward just to keep giving services, in this new system, providers and hospital systems and others, they can have incentives that you get a healthier patient, that if you're able to provide care more effectively for the Medicaid population, some of the financial rewards you can get from doing that and doing it well could be fairly lucrative. Uh, there's a question mark at the end of the equation, though. Does all of this change, these rewards, does it end up with healthier people? The jury is still out. It's a mixed bag. There are places around the country where we are seeing some improvements in health. There are places where we're not seeing improvement in health. So while it's a potential for reward of healthier people, it's not a sure thing. And there's also risk if you move into a value-based system. There is undoubtedly confusion for beneficiaries. We were seeing that in North Carolina with the beneficiaries, in our case, right before they pulled the plug on moving forward with transformation. Only about 5% of the beneficiaries had chosen a managed care company to move into. So the vast majority, 95% of beneficiaries, had this gone forward, would have just been through a computer formula, would have been slotted into one of the managed care companies, into a place where they may have very limited understanding of how it functions. Providers were struggling with the transition. There were a number of large healthcare systems and their affiliated providers who were not joining into the Medicaid transformation. They were not signing up with the prepaid health plans. Is there a long-term commitment of these managed care organizations? There's been some evidence of places around the country where managed care organizations have left, in some cases fairly abruptly, which can have a really negative impact on the health of the Medicaid population. And so you get to the same risk that we had as a reward. Does all this ultimately end up in healthier people? That's really what we, in public health and community health and population health, and certainly in the healthcare space and the nonprofit space more broadly, we want people to be healthier because of the policy shift or intervention that we made. So for all those things, and why I'm glad you're here and hopefully have stayed with us to this point, there's so much you can do to prepare, to get ready for what's coming. It all is built off a foundation of solid data, of being able to capture, to harness, to analyze data. And it's data not just of clients, of patients that might be in a healthcare setting, but of people that are visiting a housing shelter, or that are accessing food, or that are utilizing transportation. We're getting to that day and age where that ability to share information of how individuals are accessing support networks in a community becomes essential. We have to understand how these cross-sector partnerships are happening. Increasingly, for example, there are healthcare agencies that are right before our eyes, are transforming into also food distribution centers. We are starting to see partnerships between the faith community and nonprofits that are expanding the ability to create community hubs so that there could be transformation occurring across Charlotte and really in communities across the country. The top right, we look at the intersection of race and place. I mean, all of this is so critical to understand the disparities in care that are evident across multiple interventions, health interventions in our society. And we're seeing a lot of that right here in Charlotte. Certainly, we understand place, in some cases more than others. The whole Leading on Opportunity effort that looks at how in Charlotte, it's one of the most difficult places in the country. in order to advance up the economic ladder. That where you are born, your zip code in many cases, and we have unfortunately a lot of data on it that shows your zip code can be more important than your DNA code. And so understanding how race and place interact with the healthcare system is essential as well. The bottom left corner here, you see what is upstream, and the science is really extraordinary now around the developing brain and how early interventions are so critical, and you get these really big return on investment by focusing very early on in life. A lot of two-generation approaches that are looking not just at the baby and not just at mom, but looking at mom and baby and looking at that family and how do you improve the health of that entire family. And then in the bottom, in the middle, engage on health policy issues. And you see that knotted up ball. I mean, that is policy chaos. You know, we can understand how data is important. We can recognize we've got to have cross-sector partnerships and being part of those partnerships. We can recognize that race and place are extraordinarily powerful predictors of health and wellness and the ability to navigate through the system. And we can understand that going upstream to early on in life is important. But we also have to recognize that we're in an age of great disruption in policy. There is no consensus in our country. We don't have a consensus on moving towards a single universal payer plan. We don't have consensus on if the Affordable Care should be bolstered and improved or if it should be torn down. We don't have consensus on whether Medicaid should be expanded, and we're currently, because of the budget stalemate in North Carolina, we're not sure when exactly this transformation from fee-for-service to value-based care is going to happen. But all of these things are really important to be thinking about now because they're not changing. We are in an entirely new environment. And so I'm glad you're here. This nchealthguide.org is the place that we've created to help you to think about this, about how it impacts the larger community and how it impacts you. We want to try to create a better system of care in this country and in this state, but particularly here in Charlotte. And we need to start thinking, what can we do? What can any one individual do? What could any one nonprofit do to get ready? So you think about beneficiaries. I mean, these in Mecklenburg County, it'll ultimately upwards of almost 200,000 people that will make this shift into a value-based care system when it transforms. We need to get those folks ready. We need to help them, familiarize them with these changes. Who are these new brands? What's it like to work in a managed care, to navigate through a managed care environment? We need to get to nonprofits, not just healthcare nonprofits, but other human and social service nonprofits, to train their staff, to train their frontline workers so that they're aware of how this change is getting ready to happen. Development teams at nonprofits, many of them have traditionally looked at the way that they work to go and seek donations from individuals or from philanthropies or from corporations. In this new world that we're moving into, there's going to be opportunities to go to managed care companies and to others in the private sector that would pay nonprofits for the work that they do. And it's not just their healthcare work, for keeping people housed or keeping the lights on or providing healthy food. Board members, volunteers, those people that are really leading all of the nonprofits across this country, and particularly here in Charlotte, they may have little to no awareness of how these larger changes in healthcare are impacting the fundamental ecosystem of how we provide care to people in Charlotte. I also think foundations and funders need to be aware of these changes, need to think about how they might incorporate some of these things that are already happening and are soon to happen in the way that they prioritize their grants and their grant making. And I think also the general public, if you're a business owner or you routinely attend the Rotary Club as a retiree, but you want to understand what's happening in our community. How are these changes making Charlotte a different place? How is it impacting the way all of our neighbors interact with our healthcare system and get the care that they deserve? All of these different folks, depending on who you are when you're listening to this and thinking about this, what I would encourage you to do is to engage with us. So the nchealthguide.org, we will increasingly be adding additional information there. There are other webinars we're going to link you to. There are resources on all of these issue areas I've just very quickly introduced you to here. There are podcast episodes where we have interviews with thought leaders from across the country around how these things are impacting Charlotte and impacting nonprofits and impacting healthcare for people with limited resources. We do think your board, if you're a nonprofit, your staff, funders, neighbors, other supporters need to have an understanding of what this means, need to think about this for their own organization, and need to think about how they can become part of the solution to make this a better place for healthcare and a better place for all folks to thrive in this region. And I hope you'll come and look at Caring. We have a number of different programs that we can continue to do, but we are really pushing on this strategy of trying to help to educate and engage far beyond just the people that we serve, try to engage the broader community around what healthcare and this change in healthcare means for Charlotte and for our state and for our country. So I'm glad you listened. I really hope that you will take some time to look through the online resources we put together, and I certainly welcome any questions or comments or feedback that you can provide us. Thank you so much for listening, and I hope you enjoy the online site.